Hey there.
Today, we are going to talk about
4D ultrasound. We are Anna,
Ali.
Lucia.
And Maria.
and we will focus on the technology and clinical applications of this type of ultrasound.
You might be asking yourself, what is 4D ultrasound?
Slow down. Let's begin from the start.
Let us explain to you how ultrasound works.
Ultrasound is a diagnostic method that uses sound waves with frequencies higher than 20,000 Hz to create images of different organs and tissues. There are several benefits. It's painless, non-invasive. It makes use of non-ionizing radiation, captures images of soft tissue. It's fast, accessible, and inexpensive. According to dimensionality, we can have 2D, 3D, or 4D ultrasound.
2D ultrasound is composed of 2D images and it can be used to observe the internal organs and diagnose any internal issues. Some organs then can be seen in 2D ultrasound are eyes, kidneys, liver, bladder, pancreas, and more.
3D ultrasound adds another dimension to 2D ultrasound, volume, creating 3D images. It can be used in fetal, intravascular, heart, and transrectal ultrasound. Here are examples of images from 2D and 3D ultrasound, so you can observe the differences between them. In 2D, you can see the body of the baby, whereas in 3D, you can observe the baby's body but, this time, with volume.
4D ultrasound provides a continuous update of the image. The result of all these images is a movie. To sum up, 3D ultrasound, plus, movement, gives us 4D ultrasound.
It is also used, along with other studies, to dismiss genetic pathologies.
Let's talk about how ultrasound works. A device known as a transducer is moved along the skin. A gel is spread over the part of the skin where the ultrasound is going to be performed. This gel prevents the formation of air bubbles and helps conduct the sound waves.
The transducer will send the sound waves through the tissues. A monitor will record the echoes created when there is a change in tissue compressibility and/or density.
In 3D and 4D, instead of sending linear sound waves, the transducer sends waves in with different angles.
The echoes are processed by a computer program, resulting a reconstructed image with volume. In 4D ultrasound, this process is repeated continuously. The reconstructed images are saved. From those saved images, the 4D ultrasound movie is created. Let's state the main characteristics of 4D ultrasound. 4D ultrasound is a clinical dynamic tool in real time. It permits the study of the motor activity of the tissue or organs. In this method, 3 cuts are made, similar to CT imaging. It is then digitalized and reconstructed tridimensionally to form the video. This is achieved by the use of a multiplanar scanner with high definition.
Then, what does 4D ultrasound have to include? 1. Conventional echography. 2. Detailed scan of the imaging target. 3. High surface area output. 4. Storage of volume data.
But, how can we acquire volume data?
It is easy. There are 2 ways of acquiring volume data. In one hand, we have the manual, that uses conventional transducers but can only be used for 3D ultrasound. On the other hand, there is the automatic method, which makes use of volumetric transducers, and can be used for both 3D and 4D ultrasound.
So regarding 4D ultrasound, there is no doubt. We should choose automatic.
Now, focusing on automatic data acquisition system. It is used in 3D and 4D ultrasound. It uses automatic fan scanning. It is an optimal method for multiplanar data acquisition. And the transducer mustn't be moved during the scanning process. The transducers used are volumetric. There are 3 types: convex transducer, endocavitary transducer, and linear transducer.
But, why should we use volumetric transducers?
Because they are electromechanic. They permit performing 4D ultrasound. And they process between 8 and 32 volumes per second. Here you have an example of how a volumetric transducer works. It scans images in 3 different planes: frontal, the orange plane; sagittal, the pink plane; and transverse, the blue plane.
All the data obtained from the volumetric transducer is stored. A matrix array is created with the stored data. An algorithm is used to form the image using the matrix array. By storing all these images, and putting them together sequentially, the 4D video is formed. And finally we obtain.
Let us now talk about the clinical applications of 4D ultrasound. 4D ultrasound is used in a wide variety of diagnostic purposes and clinical applications such as urology, musculoskeletal imaging, and neurological damage. In relation to urology, 4D ultrasound is a highly efficient means of conducting accurate imaging of urological structures, which are the organs of the urinary tract systems of both males and females. Displaying the change of a three-dimensional image over time allows the examination of the bladder of the patient and therefore the assessment of its function in case any abnormalities are present.
This method is useful in the diagnosis of bladder tumors and/or the application of tumor ablation, especially if the patient is already suffering from any other pathogenesis such as hematuria. As the three-dimensional application of the ultrasound in 3D and 4D has a higher sensitivity than 2D ultrasound and is therefore more accurate. 4D ultrasound is also used for the imaging of musculoskeletal disorders as it has clear advantages over other imaging modalities such as CT scans and MRI, including the low cost and the dynamic evaluation over time. This has allowed 4D ultrasound to become a standard application for the imaging of sports incidents, osteoarthritis and osteoporosis, as well as bone and muscle pain.
In musculoskeletal ultrasound imaging, information is provided regarding the details of the tissue or organ being scanned. If any disorders are present, clinicians are often required to inject the patients with medication as a treatment. And ultrasound imaging plays an important role in this treatment as it allows the clinician to easily observe the changes occurring over time in the patient's muscles, tendons, ligaments and joints, which in turn allows for an appropriate diagnosis and the completion of the treatment of the patients.
Regarding 4D and the detection of neurological damage. Since 4D ultrasounds are able to capture real-time snippets of the baby moving inside the uterus, clinicians are able to monitor and analyze certain fetal behaviors.
There have been studies that suggest that the clinical application of 4D ultrasounds during pregnancy can be utilized for the early detection of neurological damage, for example children's cerebral palsy. A large percentage of the cerebral damage that causes cerebral palsy occurs prenatally, therefore allowing doctors to intervene to reduce the severity of possible diagnosed cerebral palsy or other neurological issue. By watching the fetus in the womb, behaviors can be categorized as normal or abnormal, in regard to where they sit along the fetal development and CNS maturation timeline. This is done by evaluating the opening of the eyes, variety of facial expressions, primary reflexes, and quality of general movements. The dynamic and static movements of the fetus can help to identify when neurological damage has occurred.
With things such as pregnancy, even when 2D and 3D ultrasound scans would suffice for the diagnosis and/or examination of the fetus, 4D imaging can clearly improve our visual comprehension of the present abnormalities, and thus can give a better insight and overview on the information depicted in the medical image in order to draw out a suitable diagnosis and treatment for the patient.
Furthermore, 4D ultrasound is very useful for the diagnosis of urological, musculoskeletal, and neurological abnormalities. It has revolutionized the applications of medical imaging. To conclude, we will state that 4D ultrasound definitely improves the quality of clinical diagnosis as a whole. We've reached the end of this presentation.
We hope you have enjoyed it.
And learned more about 4D ultrasound.
See ya.